Hello, everybody. Welcome. Before we begin, I'd like to take a moment to respectfully acknowledge the traditional ceded and unceded territories of the Indigenous peoples across Turtle Island and the land that colonizing peoples now call Canada. We are deeply grateful to live, work, and learn on these lands, which have been cared for by Indigenous peoples for thousands of years. We honor the lasting connection between Indigenous peoples and their traditional territories. We recognize the importance of learning from, respecting, and amplifying the histories, cultures, and contributions of all Indigenous people. And we humbly acknowledge the need to work towards restoring meaningful, honorable relationships with them, which includes advocating for the co-creation of culturally safe healthcare systems, the closing of any healthcare gaps between Indigenous and non-Indigenous peoples, and the embedding of Indigenous wellness into all aspects of kidney healthcare. My name is Michelle Lynn Goodfellow, and I'm the Communications and Engagement Manager for the PKD Foundation of Canada, which is the only national organization solely dedicated to fighting PKD through research, awareness, and advocacy, and education and support. Welcome to today's online session about being a patient partner. This session is being recorded and will be available for viewing on our YouTube channel in the coming weeks. There will be a dedicated question and answer period towards the end of today's event. Please feel free to ask questions here in the chat or in the Q&A area. Now I'd like to introduce today's panelists who have all been patient partners. Brenda Mackenzie is a PKD patient and kidney transplant recipient who co-founded the Halifax Chapter of the PKD Foundation of Canada and the Halifax Walk to End PKD. She's a valued PKD ambassador and kidney transplant advocate who has been involved in the Kidney Patient Advisory Committee of Nova Scotia Health. Nick Ashwasega is a PKD patient whose AD-PKD story was shared by Patient Voice in 2023. He has been involved as a patient partner in the Canadian review of the 2025 KDIGO AD-PKD guideline, and he has a passion for improving PKD diagnosis and care in Indigenous communities. Heidi Panuvang is a PKD and PLD patient who has received both a liver transplant in 2021 and a kidney transplant in 2025. She has shared her lived experience with PKD and PLD as a patient partner with BC Renal to improve kidney care and empower others navigating chronic kidney and liver disease. Scott Overholt is a PKD patient and transplant recipient who has been involved in the development of the Patient Partner Program at University Health Network, UHN, in Toronto. He continues to be an active member of 6 patient partner committees and has served on 14 more. Welcome, everyone. I also wanted to let everyone know who is watching that we have just learned about a new study for people with AD-PKD. And if you're interested in that, I'll be speaking more about that at the end of the program. But they are currently looking for people to participate in that study. So that might be of interest for people who are here. Let's get started, and I would love to have everyone, and I'll sort of tell you when, but I'd love to hear from all of our panelists how old you were when you were diagnosed with PKD, and when it was that you realized you wanted to get involved to make a difference for people affected by PKD. So Brenda, why don't we start with you? How old were you when you got PKD? Or when you were diagnosed?
Hi, everyone. It's nice to be on the call. Thanks for having me. So PKD ran in our family, and that my mother was diagnosed with it when I was 12 years old. So it was something that I was knowledgeable about at that time. I thought I did not have the gene because I was tested at an early age, and I thought I was fine. But I went to get health insurance of all things. And when they did the test, they wanted me to have this test because of my mother's track record there. So anyway, I did get tested, and I did find out at the age of 40 that I had polycystic kidney disease. I'm now 65. I was aware of polycystic kidney disease for a long time, but I thought I had escaped it. So no, I did not escape it. Yeah.
And when did you realize that you wanted to become a little bit more involved in making a difference for people affected by PKD?
I was involved with when my mother was unwell. So again, that was in the 70s, and she was one of the first kidney transplant patients in Atlantic Canada in Halifax. So that would have been 1972. So I was there was there used to be a peanut campaign and a candy campaign back then, of all things peanuts, which now we wouldn't be doing. But anyway, and I used to go around and sell candy, and I used to do things, participate in any functions and that the Kidney Foundation had at the time. And I was on the board of directors for the Kidney Foundation. So I was involved before I even knew I had the disease myself. So it goes back, as I said, I'm 65. So I was probably 16 years old when I was really involved.
Awesome. And Heidi, how about you? When did you find out that you had PKD, and when did you start getting involved in working as a patient partner?
Well, for me as well, the PKD was running in my family from my father. He was diagnosed in 1990, and that's when I found out that because they asked all his kids need to be tested. So there are 7 of us, and we all went for tests. And at that time, I was 29. I'm 63 right now. Will be 64 next month. And there were 3 of us in the family of 7 that have PKD. As you all know, PKD is passed down 50% to the children's. So we are the unlucky one, 3 of us. And at that time, I was young, 29, and my dad passed away in 1998, and he was 60, and I was really thinking like, that's all I'm gonna live till, because I was so worried about it, and I don't know like how this disease gonna affect me, and how that like gonna work out for my life in the future. During that time, I have young children, and I wasn't ready for this. By the way, I also passed it out to one of my kids. So he's 40 now, and he's doing okay. Anyways, during the time, the kidney, actually, the PKD didn't affect me up until like I didn't really notice anything different. And besides high blood pressure, which I've been taking medication for it regularly, seeing nephrologist once a year, no issues, up until I was in my 50s. And that's when it started showing up in my liver as well. And the cyst is going to my liver like this, going fast. And it's just, it was hard. Like my kidney was okay. During the time, my kidney was in the 50%, and yet my liver was just growing big. So in the 2016, I was introduced to go to St. Paul Hospital for KCC Kidney Care Clinic there, and I was being looked after beside. And they also sent me to VGH for my liver, also in this 2016. So I've been there for up until 2021. My liver grew to, like, by the time I had transplant, was 13 pounds. and I was huge, and people just like, it's so uncomfortable. Anyways, so I got that liver transplant in 2021, and with the medication that we have to take for anti-rejection, actually was not good for my kidney. So at the time of my transplant, my kidney function was in the 40%. And by the first year, it went all the way to 20%. So my nephrologist at St. Paul go like, this is not good. We have to change the medication from tacrolimus to sirolimus, which is softer, easier for the kidney. So that gave me about 3 years. 2 years later, it's still going down, but not as fast. So by the time I get to 20, then I need to look for a transplant, donors and all that stuff. So I've been working hard, and I got kidney from my husband, who's not matched. So we went through kidney pair exchange, which they found really good match for me. So I was really a lucky one. So I got transplanted this year, 2025, just over 3 months ago, in March of this year. So I'm doing really good. I'm able to eat. I'm just so happy. I'm just like a new person. I'm start doing exercise. I love golfing, doing summers and all that. Like I mentioned, sun is not good for my skin. So I like, not too sunny day, not too hot day. Anyway, the reason I was involved with the BC Reno, I was at KCC, and I see a post that said they need a patient enrollment, patient partner, that they want to understand how patients live with the PKD, like what kind of issue they have on their day-to-day. So then it was Helen Chews. She was, contacting me if I want to be part of it. So I went to her meeting, and it was so interesting because so many people have the same issue. I was so happy that I found a group that have the same issues that I can talk to, right? So then I signed up for that, and the study went on to find out, like, every day, like, you need to do your blood pressure test to see, if you are in the limits, and also make a list of your symptom and how, so that next time when you see a nephrologist, you can bring up and all that stuff. So it went really well. I was so pleased to be more in that group, because I know how many people in that group that so many people behind, like the care group. There was so many of them behind all this, and want to help, want to understand. And I feel so blessed that I belong to that group. And I actually, like, I was with them 10 years, and now I'm at VGS, and I actually miss them. That's my story. Thank you for listening.
Thanks, Heidi. Why don't we go to Nick now? Nick, when did you find out you had PKD? And then when did you start getting involved in some of this patient partner work?
Awesome. Well, first, thank you as well to all the participants for taking the time, and of course to my fellow panelists. You definitely have much more adventurous journeys than I've had so far. But I was 5 years old when I was diagnosed. This was the early 90s. So yeah, there really wasn't a playbook, I guess, on how to, care for a young Indigenous child. My diagnosis actually led to a lot of my family getting their first diagnosis as well, too. Majority of my cousins, aunts, uncles, mother as well. And actually, I believe had kind of made a connection with my grandfather, who had been a big Indigenous leader in the space, who had been on dialysis and lost his kidneys actually in his 40s, and who had PKD. But because of his bit of kind of captured medical history. It didn't really permeate its way through, obviously. And this is why I know genetic testing is very, very important now in the PKD space. But yeah, being 5 years old, definitely hit close to home when I had children. And that's when I started to get a little bit more involved. I have 2 young daughters now. One's turning 10 in a couple of weeks, and the other one is 5. Once I had them, it became a little bit more of an external thing that I needed to worry about, not just something I could hide internally or run away from internally, as I had been doing up until that point. And yeah, so thankfully having children definitely opened my eyes to not just the advocacy groups that were available, especially PKD Foundation of Canada, but also when I had reached out to my own doctor to get re-engaged in the health space a little bit more. I had been seeing Dr. Tobe in Toronto, and I switched to Dr. Matt Langtree in Hamilton, and he's actually the reason I got involved with the patient partner program. Because once he heard my story, I won't get into it now, but at 13 different schools before I was 12 years old. A bit of back and forth. I've lived in several cities in Canada, so definitely a unique history on ensuring that health was an important part of my upbringing, which definitely came a later point. But yeah, so definitely talking to Dr. Langtree and realizing there wasn't a big amount of Indigenous people actually still getting diagnosed, and there's a bit of a gap there still, really led to me wanting to get involved. And so being a part of the patient partner program was a great opportunity I had in 2023 to tell my story a little bit more. And from that and continuing to work in the space a little bit, I've also now been able to be involved as the patient partner, involved with, as was mentioned, part of the CSN Kitigo 880 PKD commentary guideline, which is being released, I believe, in the fall. So definitely the worldwide guidelines were released in January, but definitely watch out for the Canadian take coming in the fall as well too. And of course, as I say that, I am no medical doctor. I was the patient partner involvement, which was wonderful, but because of the patient partner program, I now have had access to some of the best people in the country with regards to nephrology, information, and also being able to network for my own family. So very grateful, but thank you for listening.
Thanks, Nick. And finally, Scott, would you share with us how old you were when you were diagnosed and when it was that you became more involved in the patient partner work?
Thank you, everybody, for giving me the opportunity to join in the panel. I probably found out when I was in my early 20s, it was another health issue, and they sort of stumbled across it. Much like Nick, I was sort of the trigger that they realized that.
Oh, and we seem to have lost Scott for a minute.
Other family members had, yeah, can anybody hear me yet?
Oh, we're back now. Yes. If you
Okay.
want to start over again when I
Sure.
edit this later, we'll get you uninterrupted.
Okay, thank you. Again, my name is Scott Overholt, and really appreciate the opportunity to participate in the panel today. I probably found out when I was 21, early 20s, another health issue that they stumbled across, that I had polycystic kidney disease. No symptoms at that point, but it did trigger, much like Nick's situation, the rest of the family. And there's a number of family members that were not well, had kidney problems, but really didn't understand what it was. So that sort of triggered that. Uneventful with my kidneys probably until I got in to my 50s. They started progressing to get worse. And when I got in touch with, under the care of a nephrologist at Toronto, at that time Toronto General, I got involved in a number of research studies that they had. And it just seemed one after another, which was great. I enjoyed it. And then the patient partner program sort of was in its infancy, and they sort of found out about me, just sort of participating in different events, and I joined the patient partner program. So that's probably about 15 years ago, and been involved with it ever since. And it's been great from a perspective that it has given me an opportunity to sort of focus on the kidney department at the hospital, and get to know a bit more about what the hospital has to offer, and just network, very similar to what Nick had mentioned.
Thanks so much, Scott. Before we continue the conversation, I wanted to, just for the sake of anyone listening who's not familiar with patient partners, just give a little short definition of what a patient partner is. So there's someone with lived experience of a health condition, such as PKD, that work in partnership with healthcare organizations, researchers, or policymakers to help improve the care, systems, and outcomes. And instead of just receiving care, patient partners contribute their insights and perspectives to help shape clinical care, health policy, research priorities and study design, patient education and communication materials, and hospital committees and advisory groups. So they can be patients themselves, they can be caregivers, they can be living organ donors. Their involvement can range from filling out surveys or joining focus groups to sitting on hospital or research committees and helping guide real decisions. The goal is to ensure that healthcare decisions are informed by the people most affected by them, and that patient voices are not just heard, but valued. So let's continue our conversation a little bit with our partners who are here today. We've talked about when everyone learned that they had PKD and when they sort of made that switch in their mind that they wanted to get more involved. I'd like to go through now and ask everyone, what was one particular project or partnership, if there were more than one, that you found especially meaningful to you, that really made you feel like I've made a difference, or my perspective was really important to be added to this project? And again, I'll start with Brenda.
Yeah, that's a great question. I think I feel honestly that there's an impact consistently, honestly, through across all realms all the time, that I feel valued for input. And it's such a great feeling because you do have something to give. And it's when the hospital starts to take this seriously and they start asking the patients to be part of, like just being on a committee to talk about chair purchases. I mean, how for the first time they asked a patient to be part of that discussion. So I was on a call to discuss chair orders and to actually talk about what was important in a chair. They had never thought of doing that before. So here you have, the hospital ordering mass, volume of chairs, and some of them very uncomfortable. Everybody asks for a pillow when they get in their chair. Can we have a pillow? So, when I brought up on the committee, could they consider maybe putting a pillow in the chair or developing a pillow that goes in the backrest of the chair? It was almost unheard of. Like, the company called me personally to want to talk about the chair. So I thought that was really, that was kind of like my first insight into how basic that the hospital needed help. Like they need our voices. I'm a member of KPAC, which is the Kidney Patient Advisory Committee, and we meet every month. And I've been on that. I mean, I swore when I got my transplant that I was going to be involved, like I wanted to give back. And so I just said, whatever there is going on, if you need a voice, call me. Like it wouldn't matter what it is, just call me. So I did get a call to go on this committee, and it has been the most worthwhile committee. We talk about everything. So there's a group of us that have been on dialysis, who are still on dialysis, some people, to people that have had their transplants, and a very sharp group of people that every time we get together, we talk about what we can do to be heard. And now there's programs, for instance, where we've written letters for nurses when they first they pass their exams and they're hired, I guess, where they would actually listen to patients. So there's a video and a letter that we wrote. How would you want your nurse to treat you, or what would you like the nurse to know? So that was one of the things that we've answered, which has been very helpful. Now we're going to be doing it with doctors, residents who are basically at the point where they're going into the hospital, that we're going to sit down with them and talk to them about what is important for doctors to know. If you're a patient, like, how would you like to be treated, and just some very important things like that. So KPAC, I think, is one of the best committees because you make a difference. And I do feel like we make a difference every day. So I'm very thankful. And it's not about always just what you give, like it's what you get back from being on these committees. That's so wonderful. So it's a two-way street. So I am just so grateful. I'm grateful that I had a transplant and I've had good health care, and I'm grateful that I can give back.
Is there anything that comes into mind in particular that you feel like you've gained from the experience?
Um, well, just the confidence. Sometimes when you're down and out and you have a health issue, it's amazing. It's not just your physical being that suffers. I think it's your mental, the whole mental part of things, because I'm self-employed. I was worried about how I was going to make it, what my income was going to be like when I was on dialysis. I mean, you're afraid. There's such a fear level. And so to be able to talk to members of the community, share experiences, I think that's where your growth can happen, not only for you, but for others. And I think we can't forget about the whole mental part of things. And we talk about that a lot in our committees about, again, not just the physical, but the mental. And that's why it's important for nurses and doctors to get to know their patient and know more about just their physical, label, that they're a kidney patient, they're on dialysis, there's a transplant, whatever. It's the person. So it's a more all around focus, not just a one item focus. I hope that answered the question, but that's what I
Yeah,
feel. Yeah.
thanks. Let's move to Patty now. Patty, is there any one particular project that you were involved in when you were a patient partner that really was important to you, or where you felt like you were so glad that you got to be there and talk about the experiences that you were having, because that would help the organization understand what people like you were feeling?
Well, I was involved with the BC Reno PKD advisory group from 2021 to 2023. That was a even short period of time, not as long as Brenda, that involves with so many programs. But this advisory group was very impactful for me because I learned so much, even though like I see my sibling going through, all the issue with the PKD and also other patients, that in our group, advisory group, and the doctors and the nurse and all those people come together and telling us like how we feel, what's what's mattered to you, and every time we meet, we always bring up each other's issues, and that having the doctors and listen to our issues, and that we create a program actually to help the PKD patient from pain management to the ends of the disease, where we go next, so that we all prepare for it. And we create that, dialysis, the two modality of dialysis, and what's best for you, or, you get to pick and all that. I mean, during that time, I was scared as well, right? Like, I don't want to be there, but at least I know that there's something out there to keep me alive. And that was a big improvement for my life, actually. And I have a really good support in the family as well. And knowing that being with this group, that all these doctors and nurses are listening to us, and whatever we bring up, they just, you know, like listen and put it down, and we create a document so that all the PKD patients can go back to look through it and see if it related to them and what's important to them and all that stuff. And it means so much to me to be a part of that, even though, as like I mentioned, it seemed a short time, but we accomplished what we came out to do with all our groups, and it was eye-opening for me.
Thanks so much. Now, Nick, tell us a little bit about how you got involved with the KDIGO review of the KDIGO ADPD, BKD guideline, and sort of what that meant to you, you know, personally.
No, definitely. It's a bit of a mouthful. I know. I don't have it in front of me, the exact, you know, long title, so I'm not going to try it again either myself. But the guideline, yeah, for me, it's very meaningful in just a multitude of ways. The first one, obviously, being able to take part in a project like this and see the amount of care that now doctors are putting into the patient perspective, especially from nephrology perspective, because I grew up, you know, in the 90s when, like I had mentioned previously, once I was diagnosed, they really didn't understand, you know, the ramifications. I remember seeing nutritionists a couple of times when I was like 9 or 10, and they're, you know, at 11 or 12 as well a couple of times. And their biggest, you know, advice was make sure you lose weight, you know, stay thin. That was always their biggest advice, which is now we've understood. And also, you know, don't eat too much protein, which we've now come to understand is actually not completely true. You can eat a very well-balanced diet with a lot of protein and still your kidneys will function at a very high level, depending on obviously other factors. But yeah, so being able to take part in that kind of guideline and seeing, because I had to also lead a work group for a particular chapter, and that chapter involved a little bit more lifestyle choices and that kind of thing, was again really important to bring a perspective from the patient side. Things like, you know, something as simple as physical activity and whether or not there's the potential to harm your kidneys. I grew up with the mentality, don't play any physical sports where you could be hit, which, talking to some of the doctors, one of the doctors has an MMA patient. So clearly, again, if we can get a little bit more continuity across the board, we might be able to give people a little bit more emotional support as well too, as patients, in an area where they're not going to be in the doctor's office. They're not always going to be there to hear that, you know, those guidelines, especially if they are maybe getting it from someone who, again, I was very lucky that after a couple of years, I got into Sick Kids, and Sick Kids is obviously, you know, I'm very grateful. They're the top of the top. They've been pushing a lot of dialogue for nephrology for many, many decades now. And even then, it was interesting to see how they had to grow in that perspective as well, too, because they didn't really have a whole lot of knowledge on the mutation. And even now we're finding out that there's a few different mutations within ADPKD as well, too. So it's really interesting. But yeah, being able to take part, as a patient, but also have an actual voice that is pushing not just the background, because I'm not a medical, you know, person at all, but how to make it in more layman's terms, but also more palatable for everyone across the country. So these guidelines are actually implemented. And funny, the BC renal one is actually one we looked at in a couple of our calls there. So apologies, it's not Fady, Patey. Again, the fact that you guys put the work into that is awesome, because that is exactly why we're trying to put the Canadian perspective on this guideline that came out. I believe it's about 256 pages long. No one's going to read that, you know, all the way through, and, you know, even though there's incredible information in there. So being able to condense it down, I think we're hoping for, you know, I believe 20 or 25, something like that, very, you know, a much smaller amount with that Canadian take. It's been just so validating as a patient, but also so exciting as just a person, especially someone who has 2 daughters who aren't diagnosed. We, you know, because the symptoms don't present themselves, we've decided that, you know, they can get tested when they're older and when they really want to. We're not going to get them tested until they really want to. And it's funny, actually, Brenda, your story really close to my sister's, and who is actually not getting retested now, even though her daughter was just diagnosed. because she, I guess, might have been tested or something previously when she was in her teenager years and was told that she didn't have it. And so she's lived her entire life now. But I was talking to Dr. Langtree, if her daughter has it, she has it. And so she is actually technically undiagnosed now in her early 40s and has a lot of health issues that could be pertaining to her kidneys. So, but all of this, genetic testing, information for everyone to be able to access it. That's why I wanted to get involved. So just right there, it's been really, really beneficial. And I look forward to being a very loud, annoying voice with this for the next few years and making sure that everyone knows all about it, especially in the Indigenous space. My biggest goal is to take the mobile ultrasounds that you can do now just with a phone. It's incredible, and go into rural communities that don't have internet access, that are never going to have an MRI machine close to them. And they still might be able to at least see on an ultrasound, you might have kidney disease and you may need to take this seriously. So like there could be, I think thousands and thousands of people undiagnosed out there who could have a better care of life just by simply knowing. But yeah, so I think I lost the second part of your question there. Apologies.
That's okay. What you have shared has been really worth hearing. I'd like to move now, though, to Scott. And Scott, I know you have been involved in so many projects through UHM. Is there one that stands out in particular as really meaningful to you, where you felt like I made a difference by participating in this particular project?
It's interesting because there's probably a lot of examples where the impact was greater, but this is a good example of just one simple question that led to completing a crucial safety improvement process that was sort of overlooked. So during a safety incident review, which basically is something went wrong with the patient and they could have been harmed or they could have died. So we review it to find out what could be done next time. So what's their takeaways so this doesn't happen again. And we've gone through and talk about the recommendations and changes in policy. And they just asked us, when will this take place? And that's all I asked. And what it very came out to very quickly is that people on the committee said, well, we really don't know. We just sort of assume that when we put these in place, that someone does put them in place and they carry through in a timely fashion. So really what that one small question did is they implemented a process to close the loop so there was feedback and documented when these improvements were made, who made them, and where they were placed if it was in a process improvement. So huge impact on quality of healthcare, but not a lot to do on my part. So I think that's really important from people that are considering being a patient partner, is thinking, well, what can I do? I don't have any medical background. In probably 99% of comments or recommendations I've made, it has nothing to do with the medical background. In some situations, it's just common sense, but the doctors and healthcare workers that are around the table are always thinking from a technical perspective, from a medical perspective. And sometimes, they miss those little items that we easily, as patients, pick up.
Thank you. That's really an interesting observation about something that, from the health care provider perspective, might not have twigged in their mind. But thank you. Before we open it up to some questions, one last thing I'd love to hear from each of you is, if you could wave a magic wand and create a new project that you could be involved in as a patient partner, or that some kind of change that you would hope to see through the involvement of patient partners, what might that be? And I'll start with Brenda. Is there anything that you would love to see that you haven't already done?
Yes, there absolutely is. It's funny you should ask that question. I find that in Nova Scotia, there is there is a silo of nephrology that works with dialysis patients, and then there's transplant. And I struggle with that all the time. And every time I have an opportunity, because I've gone to conferences as the only patient in the room with all of the policymakers, all of the nurses, all of the charge nurses, and have been in that room. And I bring it up because I just find that they're two different things. They're treated as two different things. And I don't really understand that, because the modality, like a transplant, is a modality of health that if you have kidney disease, transplants on the list is a modality. So dialysis is a modality. So I don't understand. I think transplant needs extra focus for when people actually do get a transplant. I understand that part, but I don't understand the siloed approach to transplant being on one side and dialysis and nephrology almost on the other, where they don't speak really. And I find that extremely frustrating. And I know that organ donation comes through the multi-organ transplant program. So I understand that why there's a little bit of a separation, but I think there's not enough discussion happening. And I really think that discussion needs to happen. And I would love to be part of that. And I'm driving that change because I think it has to happen. Thanks.
That's awesome. Yes, you bring up a really good point. So we hope that can happen.
Mm-hmm.
Heidi, is there anything that you would like to see, a project that you could be involved in or other PKD patients could be involved in?
Well, what I can think of is I wish the family doctor understand PKD. I think a lot of family doctor not understand. A lot of people thinking that nothing you can do about it. Like, okay, you have kidney failures, so you just have to wait until, certain functions and then you go on dialysis. And there's so many studies come out that you can do a lot more before that happens. Say exercise, eating properly, right stuff, or there's a tolvaptan that come in place for people who still have a high kidney functions. I was on tolvaptan for a year and a half, but I was already late in the game. So because by that time it's not good for my liver. So anyways, it can help those people. Like a lot of people that just newly diagnosed, they think that's the end of their life already. Like when they're diagnosed that they have PKD, they think that's it. Like there's just nothing they can do about it. I mean, if the doctor understand or send people to the proper care, like we have in BC here, like the KCC Kidney Care Clinic, they're doing fantastic job of helping from pharmacists to dietitians, to the nurse, everything. Like there's a lot we can do as a patient to help ourselves, not just depending on the hospitals or doctors. Like I hope that happen. And also I agree with Brenda about transplant, right? I mean, there's so many things that I just learned also from the past experience, that there is so many ways that we can donate or advocate ourselves to find donors and all this. And I see that BC Renos advocate a lot for people to register to be a donor, live donors and deceased donors, all that. And I seeing that, I'm just like, I'm so happy to see that, because there's so many people on the list, and that people don't even know about it. I mean, even in my group of friends, they don't understand. Like, that's why they even talk about being a donor should not be elective. It should be automatic, like, you know, like, so that you can opt out if you don't want to be, you know, like. And I see that as, I know lots of people might not like that, but I see that as a bonus, a gain for people like us, right? Like, that's awesome, you know. But most of people don't know and don't understand. That's why I think those are very important issues. Thank you.
Thanks so much, Heidi. You're right that there's a lot more education that could be happening. Nick, how about you? I know you've already talked about your dream for to go into Indigenous communities with mobile diagnosis equipment, but are there any other dreams that you have, or if you could wave a magic wand, something you would make different based on what you know?
It definitely ties it a little bit into the community going in there, but I think to give, I think, more hope from the youth perspective, and I think we are starting to see that a little bit more. So I'm going to definitely work with the PKD Foundation, obviously work with the Kiddigo group as well too, because not only is it for diagnosis purposes, but I'd like to get into each community, even just to speak to the youth there as well too, or other youth organizations, whether they be Indigenous or non-Indigenous. Just because I was one of those youth at 5 years old, they told my mother I'd probably be on dialysis and most likely potentially dead in my 20s, which I'm 36 now, and I have a kidney function, a GFRE, I believe, of 103, and my creatinine is at 87. And it's held at that. I'm on, tolvaptan. So like, I'm very, very grateful, but it was a mental health journey and a half. I will put it lightly. As my wife likes to joke, I'm a smiler. So there's a lot more pain behind that smile than I'm probably willing to admit on that mental health journey. So, and even brings me back to one of, when I spoke at the Walk to END PKD event, there was a youth there, a young person, I believe he has AD PKD1. And still to this day, I tell people about how moving it was to hear his mother come up to me and be like, "You've given my son hope. You are someone that looks athletic and you're young and you don't look like, you have these issues that we obviously have." And so it gave him a lot of hope, that there, I think she said, "You're like a superhero to him," which, having two daughters, I will still use to make them cringe all the time. But it really made me, honestly, yeah, it just gave me that hope, and so that's where my project will want to lie in the future, is to really give that youth that same kind of hope that I saw that day on the ground. Because I would have, I don't want to get too emotional, but I would have killed for something like that when I was a kid. Being told you couldn't play hockey, being told you couldn't play most sports that everyone else wanted to play, being told you wouldn't have your kidneys and you'd be on dialysis. That, we don't need to give that information to kids. We can give them a lot more hope now. So thank you.
Awesome. Thanks, Nick. And Scott, if you could wave a magic wand, is there a project you would love to see happen that you'd like to be involved in, or that you think you realize there's a need for?
I guess this is one of the reasons why I joined the patient partner program and became so involved with it. I'm really believe that if we empower and educate the patients, it's going to improve the whole medical process. The hospitals are starting to do a better job at it, but I think there's a lot of wasted resources. There's a lot of angst that people go through because they don't have the knowledge of, and it doesn't have to be medical knowledge in detail, but just the basics, because it takes that stress away from going through these processes. And if you take that stress away, people heal faster, their mental health is better. So I think that would be just to speed up that process of empowering patients and educating them.
Awesome. Thanks so much. Well, we have about 9 minutes left on the hour. people, if those who are watching live have questions that they'd like to ask of any of the panelists, please feel free. You can do that in the Q&A section or in the comment area. I see someone has put a thank you for Nick after he spoke. And she said that all of the panelists are an incredible, tremendous inspiration, and I would agree. I'd also open it up to the panelists that we have. As you've been listening to each other's stories, I've been seeing a lot of heads nodding as people have been making points that, you know, are important to you. But is there anything you would like to ask of one of the other panelists, either about the projects that they've been involved in or about their own experience of PKD?
I think this has been really amazing to hear all of you. Like I'm inspired by each of you. The whole message of hope that Nick talked about, I think is so important, because that, like being on dialysis, when you're on dialysis, you have that's a place where I think a lot of people lose hope. And if there is the ability to have a transplant, that's, I think, a big hope thing. So that's why I always think that's a very important place. It's a delicate place right there. And the other thing I was going to say, well, we talked a little bit about the mental health, but I definitely think that is so important. And no, I think these get-togethers like this are so important as a whole. So I appreciate the venue, the opportunity for us to come together and talk to people.
Thanks, Brenda.
I just want to make a quick comment about the whole premise of this discussion was sort of hopefully to encourage people to participate in patient partners. And, you know, it is really easy to put your first foot forward. You know, just go on your hospital website, and usually it's under patient experience, and they'll have some contact names. Give them a call. They've got usually a whole process lined up, how to onboard people. And the onboarding is more detailed than it used to be. They're looking at what you want out of it, what your skills are, and try to match you up with a certain committee that interests you and that you can shine in. So simple, don't be intimidated, and I guarantee you will not be surprised how much you enjoy this.
You bring up a great point, Scott, and I just wanted to reassure anyone who's watching that we normally send out a follow-up email to all the registrants afterwards, usually the day after. And one of the things I'll be including is some ways that if you're interested in getting involved in becoming a patient partner, some of the ways that you can do that, whether it's through your local hospital, through a local kidney clinic, or what have you. So, but Scott brings up a great point that it's, you know, it's the opportunities are out there. Heidi, was there anything that you wanted to ask somebody?
Well, I'm so inspired by Nick for being so young and so involved in this journey. I have a son that have this PKD. He's a bit older than you, and I wish that he knew more. He lives in Denmark, so I don't have influence in him. So anyway, but I know that he's been seeing nephrologists over there. He said, yes, I have, but his kidney function still in the 90, and I'm hoping they have the same program over there that put him on tolvaptans once he get low, or even now, like hearing Nick that having quite high and you're already on tolvaptan, which is like interesting. I thought that it should be like in the 60 before you can get on, which I was not sure of. So anyways, that it's great that you can be influenced, you know, for the young people out there to be part of this, so that they can take care of themselves before the issue get bigger. So thank you for that.
Thank you guys. It's true though. I'm very grateful that you guys have all laid the groundwork. I've seen Brenda's name around, Scott's name around so much as well too on so many things. So, like without you guys putting, the groundwork in, it wouldn't be as easy as it is for me to come in and basically showcase already the incredible resources that there are, especially to the younger people. Because, like you said, yeah, like hope is one of the easiest things we can give people. It costs nothing, so we might as well keep trying.
Thanks, Nick. I just saw a message from someone named, I think, Victoria or Valerie, who talked about, she said she doesn't have experience or something. It was in the message in the chat.
Mhm.
And I think we all have a voice. I mean, as a patient, as a caregiver for someone else, like, in my family, I helped my mother and I was very, very young and she was quite sick. She had a brain aneurysm first, which is a precursor to having a kidney failure. But the point is everyone has a voice. And I think it's when we can speak up. We do all have something to say and something to add, and I think it's important not to lose sight of that. So I would encourage, and I'm sorry I have her name wrong, but I would say get involved. If you feel like you want to, do that. Yes, Lori, do it. Okay.
And I was going, thank you, Brenda, for mentioning that. I was going to bring up Lori's comment. And I think even the involvement that Nick has had shows that there are ways that a patient of any age can provide insight into what the patient experience is like. So we would encourage you to do that.
I was just going to say one last quick thing as well
Yeah.
to Heidi. Yes, actually, so Dr. Matt Langtree, he's a big pusher of tolvaptan at any age if you have PKD, like as long as obviously you're an adult, because the latest studies have shown upwards of, I believe, 5 to 10 years potentially on kidney longevity on your health, life of the kidney. So that's why he pushed it on me. I'm grateful because if my children end up having it, I will be a big advocate for them. And with this information as well, too, I know there's a new study and a new drug they're working on that doesn't have the liver side effects. So fingers crossed that will come into, the next 5, 10 years as well.
Awesome. Well, we are nearing the end of the hour, and I want to take a quick moment to thank all 4 of our panelists for being here today and sharing their experiences and using their voice to talk about differences they have made in kidney care and/or changes they would like to see in the future. I think all of you have given us a really great wish list of things that we can be looking forward to in the coming years. I did also want to mention about the study that I talked about earlier in the event. And all my documents aren't moving. There we go. I just wanted to let people know that the pharmacy company GSK is running a new clinical study to test a potential treatment. If you're age 25 to 65 and living with AD-PKD, as opposed to AR-PKD, it's just for people with AD-PKD, you may be eligible to participate. And there are 3 Canadian study sites in Ontario and Quebec. You can learn more by visiting our website, and I will share that link with people in our follow-up email. You can also contact your nephrologist. They will be aware of this study. And if you're living in Ontario or Quebec, especially, talk with your nephrologist about whether this would be right for you. I just wanted people to be aware of that because, as Nick has pointed out, knowing that there are other things you can be doing and participating in a research study, that's an interest of a lot of people and that it's available. Oh, and I see our Kathleen, our executive director, has put links in the chat right now if people want to be getting a jump start before they get their email tomorrow. So again, thank you to everyone who's participated today. I know that I've learned a lot, and I just hope that we can continue having these conversations about what we can do as patients to change things in a positive way for everyone affected by PKD.